So, hi guys. Today I'll be talking about cervical screening, and I'm talking about it today because today I went for my smear, and I've just been thinking about a lot in terms of cervical screening. so, this is cervical screening. It's just a leaflet, and it tells you about you need to go for your screening. It's very important. It's one of the best ways to protect yourself from cervical cancer, and then talks about HPV, which is like the virus that causes abnormal changes to the cervix, and that's why they get to give the vaccine for HPV. So it tells you different types of HPV are there. You can get it through sexual contact, vagina, anal, um, and how you cannot get it. Over 80% of sexually active adults we get HPV at some point in their life. So it's something that they say don't be ashamed of it, but some people are embarrassed because of the stigma. Um, so you start screening from 25 years to 64 years. Um, for this, your names, or you get an invitation letter, and for me, I always get an invitation letter since I came into the UK. I think since when I came to do my second masters, and they always bring it every 3 years. So last year I got an invitation, but I was having a baby, so you can't do it when you're pregnant. So I postponed it. I booked an appointment. They will always give you reminders. And one of the reasons why I'm doing the video is because I was just imagining that, oh, imagine if where I come from, like the place I come from, the 5 cluster communities, they are able to have the data of women and girls from, the age 25 to 65, and they get to tell them yearly or, repeatedly telling each of them and saying that you're invited for your cervical screening, please come for it. I wonder how that is going to impact the lives of women and girls, especially because cervical cancer is among the top cancers that kills women in Nigeria. So for someone like me who comes from the Niger Delta, where we have coastal communities, remote communities that still don't have access to proper functional healthcare facilities, I'm just imagining, for example, like the health center we have adopted and in Ijali, and we just send out letters yearly to say we are reminding you for your cervical screening, and women can come to the health center. A nurse or a health practitioner who is there, who understands the whole procedure, tells them about it, talks to them about it, and then says, I'm going to do your smear, and we are able to detect any cancer that is coming up or anything that is coming up, changes in the cells of the cervix. That will be very quick, and then they can refer you to the hospital. But we don't have that, so I just started imagining, I wish it was something that comes to pass, that'll come to pass, excuse my English. And why I'm also saying this is because when we talk about the yearly campaign or the advocacy or the raising awareness for things like cervical cancer or breast cancer, we do not have such in my place. I wonder what they do with all the money. And speaking of that, some people have been elected, whether it's chairman, councillors, and like I said, I'm going to be very intentional about holding some of you, in fact all of you, accountable. So in terms of health, education, environment, and sometimes I'll be calling out your names, because so I'd love to know what you have for women and girls. If we can bring HPV vaccination into these communities, that means we can bring in screening for cervical cancer. That means we can bring screening for breast cancer. I don't really care whether you say, oh, what it's not in my agenda. Health is a priority, and it needs to be part of your agenda, your goals. So that's why I am making this video, because it is very important, because we stay in a very volatile place. What I mean by that is environmentally, we have a lot of toxins in the air, in the water. So our women and other environmental factors, social determinants as well, we are very prone to cervical cancer. We are hiding it under the name or the disguise of we don't know what it is. We have traditional healers. Sometimes it's too late before they realize it's cervical cancer or it's breast cancer. Um, but I know that there are people who are survivors who can be able to push, not just based on their influence. They have the political will to do that. So think about Warri South, Warri North, Warri Southwest if we have screenings for women regularly.